Hello, and welcome to the New York Academy of Medicine's 2021 Annual Awards. I'm Dr. Judy Salerno, President of NIAM, and today's program is a highlight of our year when we honor some of the most important innovators in health and healthcare today. Joining me here in NIAM's storied Hosack Hall is Dr. Wayne Riley, our board chair and president of SUNY Downstate Health Sciences University. Dr. Riley has been a beacon of innovation and an outstanding leader in guiding both NIAM and SUNY Downstate through what has been arguably been the most challenging time for our generation of health professionals. We hope that one day soon we'll all be back together again in this hall.
Well, thank you, Judy. It's a pleasure to be here and to be part of this special event. You are right about the challenges we have all faced over the last 20 months. We've all lost so much. Friends and family, colleagues, patients, jobs, and more. And we've also persevered. We've seen people dig down deep and rise to the challenge of finding short and long-term solutions for the betterment of all.
Yes, we've seen the best of humanity in the sacrifice and dedication of frontline workers, of community organization, and of neighbors alike in helping each other get through this pandemic. And today, we have the opportunity to thank an incredible group of individuals who have made remarkable innovations with a relentless determination to build a better world for all.
That's right, and it's so important to remember that NIAM's dedication to health equity is the backdrop to why we are all here today. We're honoring individuals who have made an impact on all people, and with organizations like NIAM and its partners who are working together to ensure equitable access to life-saving vaccines, to healthcare services, to healthy food, to safe housing and mental health support, we will continue to thrive as a city, a state, and a nation.
Thank you, Wayne, for your leadership and support of NIAM as we do this important work together. As many of you know, NIAM has been at the forefront of advancing health for all for a long time, and come January, we celebrate our 175th anniversary. We're planning a year-long celebration that reflects our accomplishments and our determination to move ahead with bold approaches to assuring that everyone can live a healthy life, no matter who they are or where they live. So stay tuned for more information in the coming months. And now please join us as we recognize, celebrate, and thank the remarkable individuals we're honoring today.
I'm honored to be here today to introduce Kariko and Weissman, this year's recipients of the Academy Medal for Distinguished Contributions in Biomedical Science. Their story of persistence and dogged determination to make a dream into reality is quickly becoming the stuff of scientific legend. Their chance meeting over a photocopier at Penn turns out to have been serendipitous for the entire world, and their partnership, friendship, and complementary attributes, perhaps even their complementary personalities, led to a series of mechanistic breakthroughs that elucidated why unmodified RNA elicits an immune response, preventing its function as a therapeutic. They used this knowledge to determine how to modify the RNA, how to package it, so that it could be safely delivered as a vaccine. Dr. Kariko pursued this work despite significant headwinds, making her an inspiration today to so many facing hurdles in science. I've had the great good fortune to collaborate with Dr. Weissman, and at every stage, I've been struck by his single-minded focus on the science, on collaboration, and on getting the job done, and his incredible generosity in sharing reagents, ideas, and his time with literally hundreds of colleagues all around the world. These two remarkable individuals, I know, are proud and delighted to be receiving this award. But I also know that what they remain intensely focused upon is the next experiment, the next advance, the next cure. As Linda Stewart of the Gates Foundation wrote in a recent perspective in the New England Journal of Medicine, quote, "We owe them all an unfathomable debt of gratitude." And I add my thanks and my congratulations to Kati and Drew.
Thank you, Dr. Epstein. It is an honor to receive the New York Academy of Medicine Award in such an incredible company. And we, together with Drew, appreciate that this prize will shed light on the importance of scientific research, as we spent years working together on this technology, which sometimes seems so very impossible.
Thank you very much, Dr. Epstein. I completely agree with Katie. To receive this honor from such a great organization, along with all of the others that have received this honor, it's a great feeling that I know both Katie and I have.
We both of us actually always believe that our work will be helping somebody. I believe and I hope that at least one person will be helped. And of course, we never dreamed about that so many people will be helped as a result of our work.
I completely agree. As a physician researcher, my goal in life has always been to understand basic research and apply it to help people. So I think we've achieved that goal.
And together with Drew, of course, we know that we are just two of us, but there were a lot of people before us who helped to advance this technology and who 50 years ago, 60 years ago were there, and we rely on their work. And even today, many colleagues who are contributing to the success of the vaccine, we are representing them together with Drew.
And I think what's important to both of us is the training new physician researchers, basic researchers, to take what we and many others have developed and to continue to develop, to continue to study and understand science, innovation, and to develop future therapies derived from our work and the work of all the others.
And our example shows that those experiments, and the path of a scientific discovery is never a straight line. There are so many twists and turns what we went through together. And so you cannot expect success in overnight happens. And that's what happened with the vaccine. People thought that it happened overnight. No, a lot of decades of overnight was there. And we work because we believed and we could find every time that we could improve the process and the RNA getting better, and so that we were always very hopeful and doing basic science, thinking about the application.
I mean, I think people need to understand that this was over 25 years of work. This wasn't 10 months invent the vaccines and treat the world. It was 25 years of hard work in the settings of difficult times. I think it's also important, at least my greatest belief is that these innovations go to the entire world, that people are vaccinated across the world. We're not going to stop this pandemic until the world is vaccinated. So we, and I know Katie and BioNTech are all working very hard to be sure that the vaccine is distributed around the world, that new sites of production are made in Asia and Africa, so they have control over their vaccines and over their production, which I think is critical.
With Drew, we learned a lot from each other. I knew more about RNA, and I learned all of this immunology from Drew. And when we were working, I have to say now that the infection happened, that we thought about a lot of the healthcare workers, because telling the truth, we had fun always in the lab for decades because we enjoyed doing, but those frontline workers, they were doing incredible thing to saving patients' life, and some of them giving the ultimate sacrifice to help others. And so we really greatly appreciate all of the healthcare workers.
Yeah, everybody that was involved, I completely agree. Thank you very much to the New York Academy of Medicine. This is a wonderful award. And I'm sorry we couldn't meet in person, but we're very honored.
Yes, and we are inspired to work harder, and we are already moved on, and we are doing research and discoveries in other fields, through probably on vaccines. And as I always was interested to do messenger RNA that codes for therapeutic proteins, so I will proceed with that.
Hey everyone, I'm Senator Tim Kaine of Virginia, and I want to thank the Academy for the invitation to be with you today to talk about something really important. I'm happy to introduce Virginians Jennifer and Corey Feist, who I've had the pleasure to work with over the last year to bring forward federal legislation to honor their sister and sister-in-law, Dr. Lorna Breen. The legislation, the Dr. Lorna Breen Healthcare Provider Protection Act, provides a much-needed investment in the mental health and well-being of our physicians, nurses, and other frontline workers. As you know all too well, many physicians have long experienced high levels of stress and burnout. And for 18 months now, the COVID-19 pandemic has only further worsened the problem. That's why I'm such a proud advocate for the mental health and well-being of our medical healers. Dr. Lorna Breen, originally from Charlottesville, Virginia, was a very talented emergency room physician serving on the front lines of the pandemic, supervising an emergency department in a New York City hospital. Tragically, we lost Dr. Breen in April of 2020 to death by suicide, a painful reminder of the toll the pandemic has taken on frontline providers. Dr. Breen suffered from something very common among health professionals, the deep stress of interacting with patients day in and day out, working tirelessly to save them, celebrating when they get better, and mourning them when they pass. Her sister Jennifer shared that Dr. Breen was, quote, confronted by an overwhelming, relentless number of incredibly sick patients. She and her colleagues worked 24/7 during the peak in New York with limited personal protective equipment, insufficient supplies, not enough beds, not enough help. Many of her colleagues were out on medical furlough. She told me patients were dying in the waiting rooms and hallways. There was just so much suffering and so much death. We do place enormous demands upon our healers, and we don't often enough recognize the mental health impact that providing medical care to very sick patients during a public health emergency can have. To make matters more complicated, as you know, it's common practice for state medical boards and hospitals to ask providers seeking licensing and credentialing whether they've ever been treated for depression. This heightens the barriers to asking for help when folks should be making it easier to ask for help. And this was a concern for Dr. Breen in seeking assistance for her own stress. In my conversations with frontline healthcare workers over the past year, I've seen that the COVID-19 crisis is going to have a significant impact on the lives of healthcare professionals for a very long time. I was thrilled that the Dr. Lorna Breen Healthcare Provider Protection Act recently passed the Senate. And we're so encouraged to see this step toward getting the necessary mental health investments our medical professionals need. I want to thank Jennifer and Corey for their tireless efforts to advocate for this legislation and to help our healers. Most of all, I want to acknowledge the incredible contributions of Dr. Lorna Breen, who cared so deeply about her patients and faced the dangers of COVID-19 head on. Thank you very much.
Good evening, everyone. Thank you so much to the New York Academy for this incredible honor. I also want to share a special thanks to Senator Tim Kaine for his support of our family and the mental health of all healthcare professionals. My name is Jennifer Feist, and I'm here with my husband, Corey Feist. We are the co-founders of the Dr. Lorna Breen Heroes Foundation. Before we talk about the importance of healthcare policies to support the well-being of the workforce, I want to tell you about my sister, Lorna Breen. who she was before she became the namesake for our foundation, the Dr. Lorna Breen Heroes Foundation, and before she became the namesake for the Dr. Lorna Breen Healthcare Provider Protection Act. Like many others who chose to practice medicine, becoming a physician was a goal Lorna had set for herself early on. She worked hard, she hustled, and she did what she had to do to become a doctor. She worked all the time, but practicing medicine was her singular goal in life, so the work was part of the price she paid, and she was very willing to do it. My sister was fun, she was funny, and she loved action. She had an intense job, but she loved it. I don't think my sister was any less driven or perhaps any more of a perfectionist than any other doctor I know. But she didn't struggle with anxiety or depression or other mental health challenges. She didn't fight with addiction, debt, habits that would have obviously brought additional challenges her way. For our family and many others, the second week in March of 2020 was the last week the world was normal for most of us. It was also the week we were on our annual ski vacation with Lorna in Big Sky, Montana. She and I sat in a hot tub making plans for her 50th birthday in October. 1 week later, my sister was immersed in the emergency department at Columbia, where she was the director at the Allen. Some might say ground zero for COVID in the US. Certainly New York was ground zero on the East Coast. 1 week later, my sister tested positive for COVID. 2.5 weeks later, she went back to work, probably still sick with COVID. She was working 18-hour days like all the others. Someone in her ER died in the waiting room. I remember she told me with great dismay that he quietly expired while waiting to be seen. She told me they had run out of places to put bodies. Not the hospital, the emergency room. Ran out of room for dead people. 25 days later, she died by suicide at the age of 49. Now, I know we're not the first people to deal with loss or grief, but when my sister died, we were all looking at each other asking, why? Why did this happen? How did this happen? We were in the news all over the world. And then something that I found to be completely unbelievable happened. People started reaching out to us to tell us their own stories, families of doctors, nurses, calling to tell us about their loved one who died by suicide, complete strangers. We very quickly learned that the suicide rate of physicians in the US is twice that of the normal population. 400 doctors die by suicide each year. And this situation existed well before the pandemic started. Before we asked our healthcare providers to save us from a virus that we didn't understand, before we asked them to provide emotional support to our dying loved ones who they don't even know, and before we asked them to leave behind their own families to do it. What? How is this possible? My sister kept telling me she was going to lose her license, lose her job, because she had required psychiatric care. She was mortified. She said that even if those things didn't happen, her colleagues would never want to work with her again. I promised her she was wrong. And then after she died, we learned that she was right. We met a doctor in Boston. He and his wife, also a physician, lost a child to a rare disease. The wife, for obvious reasons, needed somebody to talk to, but she was concerned about her license. So she sought therapy in another town under a fake name. She paid for her antidepressants in cash. She died by suicide. We met a woman in Utah. Her husband was an ER doctor just like my sister, inundated with COVID patients, overwhelmed. He needed help, somebody to talk to, but he didn't want to say anything for fear of compromising his career. Ultimately, he was hospitalized, but his insurance would only pay for him to receive psychiatric care in the hospital where he worked. He was cared for by his own colleagues. Shortly after he was discharged, he died by suicide. This is not okay. It's not normal, and it's not right. I believe my sister died because she was a physician. And despite the fact that my father was a trauma surgeon, my mother was a nurse, my brother's a radiologist, and my own husband has worked in healthcare for 20 years, I had no idea how close we were to disaster until after it struck.
In the past year, we have dedicated ourselves to understanding the complex roots of Lorna's tragic death in order to prevent avoidable loss of life among other healthcare workers. In a relatively short period of time, our foundation has captured the center of attention for this issue for the healthcare workforce and their well-being. Our work has focused on awareness, advocacy, and education. From an advocacy perspective, we have worked with Senator Tim Kaine to introduce first-of-its-kind legislation supporting the well-being of the healthcare workforce, known as the Dr. Lorna Breen Healthcare Provider Protection Act. The Lorna Breen Act has unanimously passed the United States Senate and is close to passage in the House. In fact, on October 26th, I testified in front of the U.S. House Energy and Commerce Committee, sharing the importance of immediately passing the Lorna Breen Act. As you heard from Jennifer, Lorna was convinced she was going to lose her license to practice medicine in New York because she received formal mental health treatment for the first time in her career. Tragically for Lorna, she misunderstood the licensure law in New York State. During our work since her passing, we have heard from hundreds of physicians who have shared with us a similar concern, many of whom, like Lorna, assume they will lose their license, but are not actually correct. Sharing the truth about your state's licensing laws, as well as your own institution's credentialing, and the numerous other structural barriers to mental health access, is a simple yet powerful way for every health system in this country to support their physician workforce right now. Jennifer and I want to thank the New York Academy of Medicine and all of its members for this award and for your wonderful partnership.
It's my great pleasure this morning to have the opportunity to introduce my friend and colleague, Reid Tucson. He very much embodies the values and the traditions of the New York Academy of Medicine that's been around for 174 years. And even when it began, its primary objective was to have physicians work together to advance the health of the public. So we've had that underlying mission all these years, and it certainly could not be better portrayed than by Dr. Reid Tucson. The New York Academy of Medicine has adopted as its mission to tackle barriers, generate knowledge, and change systems to advance the health of the public and advance the health of individuals. They recently have taken on a priority of eliminating vaccine hesitancy, something that is especially problematic in underserved communities. And Dr. Tucson has taken that on as one of his personal and professional priorities as well. Reid Tucson's consulting firm is very much similar to the New York Academy of Medicine in the way that it attacks current public health problems. He looks at professionals to partner with consumers in order to take on the problems that we have in the health of the public. And Reid knows how to do that. He's been doing that his whole professional life. In 1992, which was almost 30 years ago, the Columbia University School of Nursing was celebrating its centennial. And I was dean then, and I asked Reid to be the keynote speaker. And as you can imagine, a generation ago, it was not exactly a regular thing for nursing to ask a physician to be their keynote speaker at their one and only time centennial celebration, but we made the right choice. And he did a magnificent job talking with elegance and enthusiasm about what nursing had to offer the public. He was exactly the right speaker then, and he would be today. He has taught me, as I watched him all these years, and we've had similar memberships and board memberships together, that you can negotiate and still hold firm on your values and what is central to what you need to do. And he taught me how to do that. If there's one word that, in my view, tells you who Reid Tucson is, the word's classy. He's sophisticated, he has impressive character, and he has a charming habit of throwing his head in the air and laughing uproariously if you say anything nice about him. So here he is, my friend and colleague, distinguished and very nice, Reid Tucson.
On behalf of my colleagues at the Black Coalition Against COVID, it is my overwhelming honor to accept the Stephen Smith Award for Distinguished Contributions in Public Health for our work in increasing vaccine confidence among African Americans. I am well aware of the work of this award's namesake, and I appreciate the high bar that he set in his own work. This is a particularly special moment for me to receive this honor from my dear friend, Mary Mundinger, who has played such a special role in my career. And I also want to acknowledge my thanks to the New York Academy of Medicine Committee and Drs. Salerno and Riley. In the 1980s, during the height of the HIV/AIDS epidemic, I was privileged to serve as the Commissioner of Public Health for Washington, D.C. That experience indelibly impressed upon me that fighting major public health challenges requires the coordinated efforts of governments and community-based infrastructures working collaboratively together. As such, on Easter Sunday, 18 months ago, I reached out to a wide swath of community organizations, organizers, and influencers across the breadth of the DC community, and was fortunate to engage leaders from the faith, organized labor, academic, health, incarcerated and returned citizens, poets, musicians, visual artists, actors, small business, media, and public health activist communities. All of those elements we brought together into what we call the Black Coalition Against COVID in recognition of what we were about to face from the pandemic from COVID. With no money or organizational structures, we simply pulled together as a band of guerrilla warriors and got to work to bring evidence-based science into an aggressive media and on-the-ground education and engagement strategy. Before too long, as the challenges of engaging the Black community enrolling in vaccine clinical trials became apparent, we found it necessary to create a national component to our work and successfully reached out to engage and coordinate the collective competencies of our 4 Black medical schools, Howard, Meharry, Morehouse, and Charles Drew, along with the National Medical Association, the Cobb Institute of the National Medical Association, the National Black Nurses Association, the National Urban League, and the largest publisher of digital health information for the Black community, blackdoctor.org. Together, we have produced 21 national town halls that have collectively reached more than 4 million people. Our work was grounded in a strongly felt ethic of love, respect, and compassion for our community that was powerfully captured in a widely disseminated and awarded Love Letter to Black America video, produced pro bono by our friends at Real Chemistry Media Company. We've also benefited greatly by partnering regularly with the National Hispanic Medical Association, the National Council of Asian and Pacific Islander Physicians, and the Association of American Indian Physicians, as well as influential grassroots advocacy organizations from each of these minority communities. We have been fortunate enough to have attracted the support and collaborative efforts of other extraordinarily generous partners that included entities such as Made to Save, the COVID Collaborative, the Ad Council, and their partners at the Joy Collective Media Team, the Force Marsh Group, the Boston Consulting Group, Choose Healthy Life, and the Values Partnership Faith Organizations, Bio, and several other pharma and health insurance companies, the NFL Players Alumni Association, YouTube, the Black News Channel, and Shea Moisture Hair Products Company. All of these, in addition to being blessed by the unusual cooperation from federal officials, particularly Marcella Nunez-Smith and Cam Webb from the White House, Peter Marks from the FDA, and numerous CDC and NIH officials have all collaborated to help give us an opportunity to succeed. So in closing, the lessons that we have learned are that, number one, even when you don't know and where you're going and you can't see the road ahead in the midst of a crisis, and you have no money or organizational resources, you can make a difference and you can make a contribution just by going out and doing the work, doing what you can, where you can, when you can, with whatever you have available, and responding to the impulse for the preservation of life, especially those who are so often overlooked. And therefore, this work, this impulse, this sense of responsibility to others must be celebrated, nurtured, and shared with others. From that essentially spiritual ethic, you will then be provided the energy to work 7 days a week, late into the night, and be sustained over 18 months by the love and support that is brought to you from all of the people you're trying to help. Number two, we've learned that partnerships can be transformative and that there are so many people who are of goodwill in our society who will help you if you just reach out and ask for assistance and are willing to take the time to define win-win opportunities. And finally, the third lesson we learned is taking the time to engage with and listen to community partners can pay a lifetime of dividends. On behalf of all of our partners and all of our collaborators and representing them collectively, it is my honor to accept this award, and we will use it as further motivation for the struggles ahead. Thank you so very, very much.
Judy, along with these amazing individuals we are honoring this afternoon, we're also very proud to welcome 121 new members and fellows into the New York Academy of Medicine family. In keeping with tradition, the class of 2021 inductees reflect the highest levels of professional achievement. They were elected to membership by their peers and reflect a wide range of health professions and affiliations.
To our new inductees, welcome to NIAM. We look forward to celebrating with you in person early next year as we remain optimistic that it will be safe for us to gather together in person in 2022. I hope that you will engage with NIAM through the many professional networking and learning opportunities available to you here. Please join our public programming as an attendee or as a speaker. Connect with your fellow section or work group to help shape future activities, or take advantage of our other program-related opportunities as they arise. Congratulations, and we look forward to engaging with you to help move NIAM's mission forward.
Warm greetings to you all. This is Tony Fauci here at NIH, and it gives me great pleasure to introduce and congratulate the recipients of the New York Academy of Medicine John Stearns Medal for distinguished contributions in clinical practice. The recipients are Kizzmekia Corbett, Barney Graham, and William Gruber. Their remarkable contributions have been integral to the development of highly effective vaccines now being deployed to quell the COVID-19 pandemic. The emergence of COVID-19 as a global pandemic in 2020 was an historic and devastating public health crisis, the likes of which the world has not seen in over 102 years. In response, an enormous research effort was mobilized that included the development of experimental vaccines. This led to an extraordinary accomplishment, unprecedented in the annals of science: the development and authorized use by the FDA of COVID-19 mRNA vaccines in less than 1 year from the time the virus was identified and its genomic sequence made public. Seminal to this remarkable accomplishment was work from a group of outstanding scientists, including Kizzmekia Corbett, Barney Graham, and William Gruber. Their efforts have been integral to the development of safe and effective COVID-19 vaccines that have been a critical tool for public health and have fundamentally altered the trajectory of this historic pandemic. Each year, the New York Academy of Medicine honors remarkable scientists with the John Stearns Medal for their extraordinary contributions to clinical practice. Undoubtedly, the exceptional efforts of this distinguished group of scientists in accelerating the development of COVID-19 vaccines make them well-deserving recipients of this honor. And so, congratulations to Barney Graham, Kizzmekia Corbett, and William Gruber, recipients of the John Stearns Medal, for their contributions that led to the development of COVID-19 vaccines, saving countless lives and giving hope to the world that we will end the COVID-19 pandemic.
Thank you, Dr. Fauci, for that kind introduction. I'm very honored to receive the John Stearns Medal from the New York Academy of Medicine and to share it with my colleagues, Dr. Corbett and Dr. Gruber. I've known and worked with Dr. Corbett for more than 12 years and with Dr. Gruber more than 50 years, counting our time at Rice University as roommates. To be on the list with them and with Lewis Thomas and David Rogers and other prior recipients is beyond any of my career aspirations. The goal for everyone in biomedical research is that they could in some way influence clinical practice for the good, and to be recognized by my peers for that is indeed very special. One of the great joys for me has been to witness the relief of healthcare providers being vaccinated, knowing that it's made it safer for them and their patients and families. However, it's been hard to fully celebrate when 5 million people have died during the pandemic and while so many remain unvaccinated, either because of distrust in our institutions or lack of access. As we move forward, my hope is that we can improve the public understanding of biology, improve access to technology around the world, and either avoid or be better prepared for the next pandemic.
So maybe I'll follow. And again, thanks, Dr. Fauci, for those kind words. And I certainly agree with everything that Dr. Graham has said. I feel very privileged to be given this award along with Kizzmekia and Barney. It's really inspired work that was done by Barney, Kizzmekia, Jason McClellan, and their collaborators to actually develop a stabilized spike protein that really set in motion what we're seeing globally, not only for mRNA vaccines, but other vaccines as well, to turn back the pandemic. This was fundamental work. And really, I think we're only beginning to appreciate how important it was. Once this became, of course, married with mRNA technology from the likes of Weissman, Katalin, Kariko, and others, this became a very powerful tool. And I think inspired Barney and Kizzmekia, as well as inspired us to move forward with an mRNA-based technology with our partners at BioNTech. We had obviously worked with them on a flu vaccine and saw this as a path. And I think one of the fundamental things that I took away from this that was really very gratifying was the fact that we didn't just have to stand by and hope that somebody else could solve the problem. All of the people that you've represented today by this high honor were actually able to do something and championed a cause to do things in record time that had never been done before. And you've seen the fruits of that. So it's great to receive this honor. I do this on behalf of all those who basically contributed to this effort. And I'm fortunate that I led a talented clinical research and development team at Pfizer that helped make that possible.
And thank you for those remarks. And I echo many of the sentiments that were shared. It's an honor, of course, to be getting an award like this alongside my longtime mentor, Dr. Graham, and Dr. Gruber as well. We, in the field of vaccinology, I think we always have to come with the slant of empathy. I think vaccinology in itself is a field that really exemplifies what empathy really means. And that comes not only because we are advancing technologies, but also because of our understanding of what those technologies mean to every single person in the world. And because of that, the work that we have done is certainly not over. You know, getting gratifications and honors such as this for rapid development for what is the world's most deadly pandemic in over 100 years is something that comes with the knowledge, as Dr. Graham has said, that there are so many people who are still vaccine hesitant. There are so many people around the world who don't currently have access to the vaccine technologies. And so I think that that is one of my hopes for the future. Not just that this moment lays a foundation for what is revolutionary scientific advances that will make vaccines in the future faster and safer and more effective, but also that it will make vaccines more accessible to everyone. And it has been an honor from the inside to watch this moment unfold and to use our knowledge in the way that we have and to contribute in this way. And it will continue to be an honor from my new post as an assistant professor to use my knowledge to answer critical viral immunology questions to advance similar types of novel vaccine platforms. But for me, the real honor comes in the understanding that every person has access to these types of technologies. And then also in being able to watch newer generations of scientists emerge as they've been inspired by this moment that we've all in our work have presented. And so with that, I say thank you. And I am so happy to be here to see Dr. Graham once again, to meet you, Dr. Gruber, and to really have this conversation about what this moment means for vaccinology, what it means for clinical care, and what it means for the transformation of medicine in general.
My name is Mia Jung, and as a fellow New York Academy of Medicine board member who was recruited by this honoree nearly 3 years ago to join the board, I am humbled by this distinct opportunity to introduce Jim Flynn as the winner of the Academy Plaque for Exceptional Service to the New York Academy of Medicine. I'm also supremely grateful to our hosts of the evening, NIAM President Dr. Judy Salerno and Board Chair Dr. Wayne Riley, for the invitation. This honor has been recognized since 1952 with an award of distinction for fellows and affiliates of the Academy. Individuals are recognized for sustained engagement with the Academy over an extended period, making major contributions to the success of the Academy's mission and programs, its role in the broader community, or its organizational growth and development. Given the context of this award, I couldn't imagine a more worthy recipient of this esteemed honor. As someone who met Jim and his wife, Carrie Ann, 7 years ago through a mutual friend, I was acutely aware that he was a successful investor running a highly respected healthcare investment firm based in New York City. But as I got to know Jim more, I learned that his investment success was the least interesting thing about him. Through his colleague, Leslie Henshaw, I learned that Jim took over managing Deerfield almost 17 years ago and led an enormous transformation, adding people, assets under management, new investment and drug development capabilities, an impressive building anchoring health innovation in central Manhattan called The Cure, and a range of creative philanthropic programs. He did so guided by the founder's mantra of, let's do the right thing as if we are invincible. No one could have been a better torchbearer for this guiding principle than Jim Flynn. I've also had the good fortune to have held a front row seat in witnessing the impact of these creative programs Jim has championed over the years. And as a result, Deerfield has not only been a leader in healthcare investing in more than 200 companies, which provide life-saving therapies and services to millions of patients, but he also has been leading the way in diversity efforts, creating a fellows program to address the lack of diversity within investment firms, a woman in science program to address the gender gap in innovation. And 6 years ago, I knew exactly who to turn to as I sought an investment partner to address the lack of gender diversity in the boardroom in privately held healthcare companies. Thanks to Jim's support and passion for equity, countless underrepresented investors, executives, and patients have been given the access they deserve. When Jim reached out and asked me to join NIAM nearly 3 years ago, I knew very little about the nonprofit, but knew if Jim was involved, it would be an organization that was destined to make an impact on people's lives, and I absolutely wanted to be part of it. Over the past 8 years of his board service, Jim has served as the vice chair for 3 years and board chair for 2 years. Jim has been a steadfast supporter of the Academy and committed to its mission. He has been a close and respected partner to the Academy and its work, and he is a nationally recognized leader in the biotech community and has always made resources from Deerfield available to help NIAM. In addition to all I mentioned, I would be remiss if I did not mention Jim also holds a purple belt in Brazilian Jiu-Jitsu. In closing, I will quote one of my son's favorite superheroes and one that I think perfectly embodies our honoree. With great power comes great responsibility. It is my distinct pleasure to congratulate Jim on this well-deserved award and introduce him to you all.
Thank you, Mia, for that kind introduction. You two have been extremely impactful to the Academy, and it's been a pleasure to work with you and the other trustees over the years. The New York Academy of Medicine is actually a very easy organization to want to help. Its focus is on making sure that everyone has the opportunity to live a healthy life. And as we all know, health is fundamental to our ability as individuals to be independent and to lead fulfilling lives. Our collective experience with COVID has unfortunately demonstrated again that risks to health and the opportunity to access healthcare are not distributed equitably due to a range of sometimes very complex factors. The New York Academy of Medicine is unique in its ability to not only assess the root causes of health inequity, but to also assemble the relevant stakeholders and to push forward solutions, whether they involve legislation, regulation, or the mobilization of communities and businesses. I think all of the staff, trustees, fellows, and other contributors should be very proud to be associated with this organization that has such a profoundly important mission and capability set. I also want to send a special thanks to Judy Salerno. In addition to her weighty contributions as president of the Academy, she threw herself back into medical practice to increase our system's capacity to treat COVID patients at the worst point in our city's experience. At the other end of the spectrum, she has also proven through our events and galas that while seeking to positively affect the health of millions of people is serious business, we can also have some fun while doing that. So with that, I want to thank you all very much.
Congratulations to all our awardees this evening. You have our sincere thanks and appreciation for your incredible achievements. This has been a truly historic event for NIAM. It's also our first full awards program since the pandemic began, and our awardees represent the top minds that have worked relentlessly to help bring us out of this pandemic and to position us for a healthier future. We're thrilled to close the program with special remarks from another individual to whom we owe a debt of gratitude, Dr. Anthony Fauci, Director of the National Institute of Allergy and Infectious Diseases. While Dr. Fauci has become a household name for his work related to the pandemic, what many of you may not know is that he has advised 7 presidents and has been on the front line of scientific breakthroughs for most of his career. We're thrilled to have him join us today. Welcome, Dr. Fauci.
Thank you for that kind introduction, Dr. Salerno. I also want to thank the New York Academy of Medicine for inviting me to join you to celebrate these remarkable honorees for their tireless efforts to advance public health. And on this occasion, let me also welcome and congratulate the incoming New York Academy of Medicine fellows and members. The challenges posed by the COVID-19 pandemic at home and abroad have brought into sharp focus the world's need for the science and art of public health professionals and the imperative to vastly increase the support of our public health enterprise. Your expertise, your energy, passion, and commitment are needed now more than ever. As director of the National Institute of Allergy and Infectious Diseases for the past 37 years, I have been privileged to help lead the biomedical research response to a number of public health emergencies, beginning with the emergence of HIV in 1981 to fears of bioterrorism following 9/11 and the anthrax attacks to outbreaks of pandemic influenza in 2009, SARS, Ebola, and Zika, and currently to the COVID-19 pandemic. Our country's experience with COVID-19 has highlighted the pivotal role of scientific perseverance, dedication, and innovation to protect public health. At the start of the pandemic, a vigorous global scientific response resulted in the development and deployment of several highly effective COVID-19 vaccines in record time. Despite their rapid development, the foundations for these vaccines were laid through innovative research advances made decades earlier. The concept of the mRNA vaccine platform began as a result of scientific ingenuity and evolved over years to become a reality. In addition, the discovery of the stabilized and conformationally correct spike protein of the coronavirus used as the immunogen in multiple COVID-19 vaccines began with exquisite structural biology studies that expanded to collaborations across multiple disciplines. Innovators and scientific leaders, including those key individuals whom we are honoring today, advanced fundamental research that enabled the development of the safe and effective COVID-19 vaccines that have saved countless lives around the world. However, although the remarkable effectiveness of these vaccines provides hope that we can end the COVID-19 pandemic, our work is far from over. We must overcome vaccine hesitancy and remain vigilant to ensure that we finish this marathon race. We also must apply what we have learned and continue to preempt and outwit other pathogens and public health threats that may emerge in the future. When this pandemic began its sweep around the globe more than a year ago, it quickly hobbled hospitals and imposed crushing levels of stress and strain on their medical staffs. The more than 700,000 American deaths from COVID-19 are heartbreaking testimony to why we need to invest more to support public health. We also must work harder to overcome the unacceptable disparities in health experienced by minority groups, especially African Americans, Hispanics, and Native Americans who have been disproportionately impacted by COVID-19. In the face of all these major challenges, the public health enterprise needs to nurture and expand the pipeline of extraordinary leaders, such as the remarkable individuals we are honoring here today. Their commitment, ingenuity, and dedication to public health has been extraordinary in the face of historic challenges and makes them eminently worthy recipients of these awards. Please take heart knowing that science has lit the path forward to how we can and will, with perseverance, end this pandemic, restore our vibrant and connected lives, and protect public health moving forward.
Thank you, Dr. Fauci, for not only joining our event this afternoon, but also for your passion and dedication to science, to advancing health, and moving our country past this pandemic. We are honored to have you address our honorees, our new fellows and members, and our entire NIAM network.
And what an incredible network we have, ranging from today's leaders to the next generation of health and healthcare leadership, all dedicated to advancing health. From all of us at NIAM, congratulations to our honorees, and thanks to each of you for supporting our mission. Have a good evening.
Have a good evening.